Hi, good evening, and welcome back to this 11th session on the histology slide discussion. We had started with the discussion of general histology slides, then we had taken up respiratory system, and we were continuing with the digestive tract. We have finished the discussion of the slides of esophagus, stomach, and small intestine during last 3 weeks. Today, we will close the discussion of digestive tract by discussing two slides which are related to the digestive tract, that is large intestine, right? Let's get started straight away with this slide. Now, what is this slide? This is the slide of vermiform appendix. Okay, so what is this slide? This is the slide of vermiform appendix. Now, the question is, how do I say that this is the slide of vermiform appendix? Or if the examiner asks you, how did you identify this as the slide of vermiform appendix? How will you go about? So remember, we can see 4 layers of GIT. The mucosa, then the submucosa, the muscularis externa, and then we have the serosal layer. So all 4 layers are visible here. This is the first. But how do I say that this is the slide of vermiform appendix and not the slide of esophagus, nor stomach, nor small intestine? Remember, the lining epithelium appears to be simple. So if it is simple epithelium, we have ruled out esophagus. Because esophagus has stratified squamous non-keratinized epithelium. So we have ruled out esophagus. Then we need to rule out if it is stomach or small intestine. If you see the lining epithelium, we can hardly make out the crypts. There are no villi and there are very rudimentary glands. So since there are no gastric glands, what is ruled out? The gastric pits, and hence the stomach slide is ruled out. Since there are no villi, small intestine is ruled out. So this has to be the slide of large intestine, and one of the part of the large intestine is your vermiform appendix. There are other features which will help us differentiate that this is vermiform appendix. So you would start your answer with, sir, this looks to be the slide of vermiform appendix because we can see 4 layers of GIT starting from mucosa to serosa, and the rudimentary crypts are seen, or rudimentary intestinal glands are seen with the lymphoid follicle located in lamina propria. I'll repeat again, lymphoid follicle located in lamina propria with a possible disrupted muscularis mucosa. This suggests that the slide could be vermiform appendix. Then the examiner will ask, how did you differentiate this from the slide of large intestine, small intestine? We'll get to that discussion. Right? Done. So you have answered the first question of the examiner, like why this slide is vermiform appendix. Now the examiner will ask you to explain this slide. So you start like, sir, the mucosa of the vermiform appendix. Okay. So let's imagine this is the entire mucosa. This is the submucosa. Here we have the muscular layer, muscularis externa, and this is the serosa. Remember, entire appendix will have serosa. Now, the mucosa has lining epithelium, right, which is simple columnar, right? Simple columnar epithelium with plenty of goblet cells. Then we can see rudimentary crypts. So we can see rudimentary crypts, which are the intestinal glands. Then we can see the lamina propria, right? The peculiarity of the lamina propria is we can see lymphoid follicles. Remember, in case of ileum, where the lymphoid follicles are seen, they are predominantly seen in submucosa. I'll just show you the slide of the ileum that we had discussed. So where is the lymphoid follicle? If you see, this
recording in progress.
Mucosa. Now, since this is the muscularis mucosa, the lymphoid follicle is present in the submucosa. Whereas here, in case of vermiform appendix, the lymphoid follicle is primarily present in lamina propria, and because the muscularis mucosa is disrupted, it seems to extend into the submucosa. Are we clear? Right. So lamina propria with lymphoid follicle. This is the mucosa. Then if we see, we can see faint muscularis mucosa, which is not well defined. Now remember, this is a very peculiar feature of vermiform appendix. Disrupted muscularis mucosa. This is one of the typical feature of vermiform appendix. This is the reason why the lymphoid follicle appears to extend into the submucosa. Basically present in lamina propria, seems to extend into submucosa because of disrupted muscularis mucosa. This is how we identify it. Are we clear? Done. Then the submucosa is unremarkable. It is dense connective tissue filled with larger blood vessels, lymphatics, and mesenteric plexus. If you see the muscular layer, there is this inner circular and there is outer longitudinal layer. And the last layer, of course, is made up of serosa, which contains mesothelium plus subserosal connective tissue. Are we clear? So what are the features to tell that this is the... So what are the clinical features to tell that this is the slide of vermiform appendix? So remember, the first is the simple lining epithelium, which has rudimentary crypts, then a disrupted muscularis mucosa with lymphoid follicles in lamina propria. This is the characteristic feature of vermiform appendix. Now, if the examiner asks, how do you differentiate this from the slide of ileum? We'll go back to the slide of ileum. This is the slide of ileum. How do I differentiate this? We can see short villi, right? Rudimentary villi. Then we can see intestinal crypts. Then we can see Peyer's patches. So remember, Peyer's patches are typically found in submucosa, whereas the lymphoid follicle of the vermiform appendix is typically found in lamina propria. We can clearly identify a very well-defined muscularis mucosa, which is a feature of all the slides of small intestine. Done? Are we clear? So presence of villi, presence of lymphoid follicles in submucosa, a well-defined muscularis mucosa. All of these will actually define the slide of the ileum. Are we clear? Right. Now, once we have done this, let's take a look at the slide of colon. If you recall, the large intestine is made up of cecum and appendix as the proximal part. Then it has colon, which is divided into ascending, transverse, descending, and sigmoid. Then we have the rectum and anal canal. How does the slide of colon looks in microscope or under the microscope? This is the slide of colon. Now, how do I say that this is the slide of colon? Again, we can see 4 layers. What are the 4 layers? Let's mark. This entire thing is mucosa. What is present here? This is submucosa. What is present here? Muscularis externa. And finally, we have serosa. And in some places, we get adventitia as well. We will see where do we get adventitia. Now, one striking thing I want all of you to notice is, take a look at the surface epithelium, flat. Take a look at the surface epithelium of the colon, flat. Take a look at the surface epithelium. Can you make out surface epithelium? No, because of presence of villi in duodenum. Again, if you see jejunum, you cannot see that surface epithelium. Yes, a flat line. So if you see here, here also you will not see it. This should tell you that you are actually looking at the slide of large intestine. If you see those 4 layers, there are no villi, there are no gastric pits, then the surface epithelium is not irregular. It must be a slide of large intestine. Done? Right. So how about the features of colon? The colon is also lined by what epithelium? Again, simple columnar epithelium. What is the main function of large intestine? Absorption of water and vitamin B12, right? Then, if you closely observe, there are plenty of well-defined crypts of Lieberkühn, but these crypts are studded with the mucus glands. Not mucus glands as per se, mucus cells, which are called as goblet cells. Why do you see plenty of goblet cells? Just take a look at it here. you have these empty appearances, right? All these are the goblet cells. This, all of this are goblet cells. Now, why do you see plenty of goblet cells in large intestine? These goblet cells secrete mucus, which will facilitate the passage of stools in the large intestine. This is why the number of goblet cells will increase gradually from esophagus, and they are found in plenty or maximum at large intestine, right? So surface epithelium, simple columnar, which dips down to form the crypts, which are studded with mucus cells or goblet cells. Then the lamina propria and a very well defined muscularis mucosa again. So this is the muscularis mucosa. Then again, what is this? This is the submucosa, dense connective tissue with your blood vessels, lymphatics, everything. If you see, this is the circular layer and this is the longitudinal layer of smooth muscle. One of the peculiar feature of the large intestine is, so remember, this is the slide of colon we are discussing. We need to identify Taenia coli. Now, what are Taenia coli? Taenia coli are aggregation of smooth muscles found in the longitudinal layer, found specifically in large intestine. Now, in this particular field, we do not see a Taenia coli. If you see Taenia coli, the longitudinal layer will be enlarged like this, and here you will have the smooth muscle bundles arranged as longitudinal sections. If the section has gone at the level of Taenia coli, you will see it. So don't get confused if you don't see Taenia coli, because in this particular field, we do not see Taenia coli. It doesn't mean this is not the slide of colon. How do I say that this is the slide of colon? There is absence of villi, right? We do not see finger-like projection. So complete absence of villi is the characteristic feature of large intestine. Let it be vermiform appendix, let it be colon. Then crypts, which are basically studded with mucus cells or goblet cells. Then a well-defined muscularis mucosa, circular and longitudinal layer. If you're lucky enough and the section has passed through Taenia coli, you may even identify Taenia coli. Remember, the ascending colon and descending colon, these are retroperitoneal organs. So their front and sides will have serosa, posterior surface will have adventitia, whereas transverse colon and sigmoid colon are covered by transverse mesocolon and sigmoid mesocolon. So they do not contain adventitia, they contain serosa. This could be an important viva or discussion question for you. Which part of the colon has serosa? Which part of the colon has adventitia? So remember, posterior surface of the ascending colon, posterior surface of the descending colon have adventitia. Rest everything, front and sides of ascending colon and descending colon, and then the entire circumference of transverse colon and the sigmoid colon all contain serosa. There is no adventitia. Why? Because these are the surfaces of the colon which are covered with peritoneum. Are we clear? This is how we identify the slide of colon. Now comes the question, how do you differentiate this from the slide of small intestine? So let's take a look at this. What is this slide? This is the slide of the duodenum. Now again, how do I say that this is the slide of duodenum? If you see, there are long leaf-shaped villi, but the characteristic feature again here is this. Let's label it. Now what is this? The presence of Brunner's glands. So remember, if you have submucosa which is studded with mucosal glands, the slide has to be the duodenum. How do I say that? This is the slide of jejunum. If you see the slide of jejunum, the jejunum has long finger-shaped villi. You will see the longest villi in jejunum, right? And sometimes if you're lucky enough, you can even see the plica circularis. The submucosa is characteristically unremarkable. Nothing except connective tissue, blood vessels, nerves, and lymphatics is present in the submucosa. So submucosa of duodenum, Brunner's gland, submucosa of ileum, the Peyer's patches, submucosa of jejunum, nothing. So longest villi with nothing in submucosa, jejunum. Long villi or leaf-shaped villi with mucus glands in submucosa, duodenum. This is the slide. If you have lymphoid follicles in the submucosa and short, blunt, club-shaped villi, that is the slide of ileum. Very often you can get confused between the slide of ileum and appendix. So remember the thing I told you, this is the slide of the ileum. You will see the villi. So the surface epithelium looks disrupted. It's irregular. Let's compare this with the slide of the vermiform appendix. See the surface epithelium? It is in like one line. This should help you to identify between vermiform appendix and then the ileum. Are we clear? So this is how we should go about identifying the slides of digestive tract. There are two more slides that remain in digestive tract. Three more actually. One is the slide of liver, then pancreas, then gallbladder. We will discuss all these three slides in the next class on Thursday. So let's try and close the digestive system, and after that we will take up rest of the slides. Done? GI slides, if you observe the differences, it is very easy to identify. Otherwise, they are very confusing, right? All it needs is little bit of focus, how to identify the slide. So my first suggestion, always look at the layers. If you see 4 layers, then it's a slide of GIT. If the lining epithelium is stratified, it has to be esophagus, nothing else. If it is simple, then you need to rule out stomach, small intestine, large intestine. If you have villi, it is small intestine. Then how do you differentiate between the three? The submucosa should have Brunner's glands in duodenum. If Peyer's patches are there, then it is ileum. If nothing is there, then it is jejunum. If you have depressions rather than elevations, which are villi, this has to be gastric pits, which could be fundus or pylorus. I'm sorry. Fundus, how do we identify? We have shallow gastric pits. How do we identify pylorus? They have deep gastric pits. Gastric pits occupy almost 2/3 the length of the mucosa. How do we identify large intestine? We identify it by absence of villi, absence of gastric pits. The lining epithelium is almost in a straight line. Vermiform appendix has rudimentary crypts with a disrupted muscularis mucosa, which leads to extension of the lymphoid follicles from lamina propria into submucosa. How do we identify the slide of colon? The slide of colon will contain again a single line of surface epithelium without villi. There are well-defined intestinal crypts or crypts of Leberkorn, which are studded with plenty of goblet cells. So instead of normal columnar cells, you will see plenty of goblet cells. Done. And if you are lucky enough, you might even identify the tinea coli. This is how you should approach identification of slides of GIT. Fine. If you have any doubts, leave your doubts in the comments. We'll try to address it when we take up the slides of liver, then gallbladder and pancreas. Most of you will be preparing seriously for your second internals. So wishing you all the best for your preparation and your upcoming second internals. We'll take up a few more slides next Thursday. Good evening and thank you.